Reach out with health, reach out with hope, changing hearts with every show. From the stories that we tell to the hands we teach to grow. ROI stands for everyone, where knowledge lights the way. Reach out with health, let's make tomorrow safe.
Health Connect Forum. The program comes your way every Wednesday from 10 a.m. To 11 a.m. here on Municipal FM 95.3 Abuja. Health Connect Forum is brought to you by Reach Out Health Awareness Foundation. My name is Imo Ebong. I am your host. Well, the program, if this is your first time of joining us, Health Connect Forum, focuses and serves as across Nigeria as a platform where stakeholders across the health sector and the development space can come together, promote what they do, exchange ideas and chart a way forward, especially at a time like this where Nigeria and of course other African countries are dealing with the issues of spiraling funding for this space of development work. Well, every year millions of naira are invested into healthcare programs across Nigeria. From maternal healthcare to immunization campaigns, malaria treatments, nutrition support, HIV services, and medical outreach. It's a long list, right? But at the long run, does the much talked about help and intervention support, does it really get to the people it is intended for? Does it get to them? In many communities, the people who need help the most are often left behind. Now, that will be the focus for the program today. Why do many free health services fail to reach the people they were created for? That's a big question. Where is the disconnect between intervention and real impact? Well, my job here will be to ask the questions. Our guest in the studio this morning joining us is an expert. I'd like to refer to him as a father, not just physically, as a father also, a father figure in the sector. Of course, he has experience that spans many years, and he didn't just do that around the corner. He did it around the world, touching some of the biggest names and working across some of the most remote locations and creating some of the biggest impacts, as you get to find out if this is your first time of joining the program. Mr. Joshua Ida Samson is a strategy management and development consultant. He has experience in supporting multiple USAID supported development projects and interventions. It is indeed a pleasure to have you join us this morning again on the program, Mr. Samson.
Thank you very much. Thank you for
Maybe
having
we'll
me.
bring you back home and say, Oga Samson, you are welcome, sir.
Thank you so much. I'm delighted to be here again.
Thank you, sir.
Yeah, and Barka the Salah.
Oh, yes, absolutely. Getting to the studio was a little rough. Our friends and brothers were all over the place enjoying Salah. I hope that we get served our own share of the barbecue that comes with it. Quickly, today the program will touch on very important issues bordering why the much talked about help, free health services, rarely or scarcely gets down to the people that they were meant for. And we'll do the best that we can. And we hope that you will join the conversation. 20-25 minutes thereabout, we should be able to throw the lines open so you can join the conversation and share your thoughts, ask questions if you will. We've set the tone for the conversation. Remember, we're broadcasting on Municipal FM 95.3 Abuja and Amak Community Radio in Karachi is 88.5, I guess. All right. Well, do well to join us in the conversation this morning. Let's quickly jump into it. Mr. Joshua, we look at Nigeria. You're the expert here. Your experience cannot be compared to so many. Nigeria has many free healthcare programs. You hear about fantastic reports, conferences, you name it. Why are so many vulnerable people still unable to access health care?
Thank you very much for giving me the opportunity to think in that direction. Nigeria has several free healthcare programs. But unfortunately, how many people at the community level know that these programs exist? For example, we have the Basic Healthcare Provision Fund, and this is supposed to happen at the 36 states, including the FCT. And it provides several services that cover antenatal care, delivery, postnatal care, immunization treatment for malaria, and all that. But how many community people know that government has put this structure in place and for them to access? And then we also know that even these free services are targeted. It's not everybody that have direct access to it. And why are those restrictions? So part of our problem is we put systems in place, but the beneficiaries who are supposed to know how these systems benefit them are not even aware that these structures are there for their benefits. So we need to find a way to carry them along and get them informed about this opportunity and where they can go directly to have access without any fear or judgment, because sometimes people go to where these facilities are, and because you don't know the who you know sometimes can matter in Nigeria.
Man no man syndrome.
Exactly, and that deprive our community people from getting the best of the structures that we put in place as what we call, quote unquote, free healthcare services. Yeah.
All right. So quickly, we've talked about this, right? The problem is some of the people that these programs are designed for, they don't get to access these services.
Yeah.
Can you help us identify some of the critical barriers that bring about this disconnect between the service and the community people who are supposed to receive this service? What are some of these barriers?
You see, when we plan these programs, even at the design phase, community members aren't carried along. At the planning phase, they are not carried along. That in itself is a barrier. And so his income is consumed to go and get services. And then he now has to trade off a decision. Should I spend the 2,000 I have here to take care of myself? Or do I spend it on logistics to go to where I might go to get services, and I get there, I get discriminated against? The queue is so long that by the time I'm done, I'm hungry and tired, fagged out, and then coming home empty stomach, I may not even still have gotten the services. So there are a lot of logistical challenges and lack of proper communication and awareness on how to manage entrance into where the free services are, how to request and ask for what is your right. Because we're at a point in Nigeria where we don't even have a right anymore. And it's unfortunate, right? It's unfortunate. So there's a need for us to overcome some of these hurdles and give communities this encouragement that they need to ask questions about what is it that government is doing for us, and how do we get it, because it is for us. And if we are denied, what should we do? Whom should we talk to? Who will listen to us when we want to talk? So we should put structures in place for communities to be able to ask questions about what belongs to them.
Indeed. Now, let's. If you just joined us, the program is Health Connect Forum, brought to you by Reach Out Health Awareness Foundation. We're discussing this beautiful Wednesday morning, as we do every Wednesday here on Municipal FM 95.3 Abuja. Today we're discussing the issue of why the people who these free health services are designed for do not get the services.
Yes.
That's our focus this morning. All right, Dr. Joshua Ida Samson is our guest. And Doc, let's take this deeper. At what point do health interventions usually begin to fail? Now, we've identified some of these barriers. At what point? Because you just don't know who is listening. What we're discussing is to put light on the issues. It may help somebody out there who's listening. At what point do these interventions begin to fail? Is it at the planning stages? Is it at the implementation, communication, or monitoring stage?
You see, we have different layers in the process of intervention, design, implementation, and reaching out to the beneficiaries.
Okay.
If at the planning stage, we put structures where communities don't have direct access to benefit, it defeats the purpose. You put a healthcare center 10 kilometers away from the village. There are no vehicles, no transportation system for the community members to go to access this 10-kilometer service. By the time they trek to get there, they are hungry and tired. They get there and the centers are stocked out. The services are not there. It defeats the purpose. So even in the planning, at the planning stage, you want to ask the community, where do you want this service to be located? Because location is very important.
Indeed.
And then you also want to, the people who are involved in the provision of the services, and there are several networks actually, the NGOs, the CBOs, and then the health center themselves. How well connected are they in terms of information management and transfer to the communities who should know what they are providing? And if this is not happening, you may have something that is sitting there and somebody is passing by, I won't know that is where I'm supposed to go. So there should be shared information on what's available, how they should be accessed, and then if there are any challenges in that process, how should we overcome them?
Indeed.
Community members need to know that. Like I said earlier on, then they need to know how to ask for their rights.
Indeed. All right, we'll take a quick break, and when we return, we'll announce the phone number you can call to join the conversation. Drop a question or share your thoughts with us on this issue. If you're listening, you're a non-governmental organization, an international non-governmental organization, often referred to as INGO. You're a corporate organization, and you, as part of your CSR, you have projects that are life-touching and you'd like to talk about it. This is the platform. Health Connect Forum. You can get in touch with us. Reach Out Health Awareness Foundation. We're located at Block 10, Plot 12, Shuaibu Maman Lafia Street, Gwarimpa, Abuja. Or you can call 0703 044 8318. That is 0703 044 8318. You can also call 0813 973 0664, or simply go to our website, that is www.reachoutwithhealth.org. We'll take a quick break. When we return, I'll let you have the phone number you can call to get in touch and join the conversation. We'll be right back. All right, thanks for staying with us. The program is Health Connect Forum, broadcasting on Municipal 95.3 FM, Abuja. Health Connect Forum is a one-hour talk show that gives everyone who cares about their community, everyone who cares about touching lives and measuring impact, health impact, one community at a time. This is the place where we meet every Wednesday to have these conversations. Well, thank you for joining us. And don't forget, our guest is Mr. Joshua Ida Sampson. He is a strategy management and development consultant. He's experienced, he's worked for several organizations, he's handled several nationwide projects, health intervention projects, and you name it. All right, the number to call to join the conversation this morning is 09122596595. That is 09122596595. All right, if you call the number, you'll be connected to the studio and you can share your comments, thoughts, and if you have questions, we can actually look at them. This morning we're discussing why free health services do not get to the people, the communities they are intended, they were designed for. Mr. Joshua, let's quickly get back to this now. How serious is the issue of poor awareness in health delivery? Now, because in many communities, people either never hear about the programs or hear about them too late.
Very, very serious. More serious than anyone could ever imagine. It's like somebody who has been wheeled a gold mine and is unaware that this opportunity is mine to tap in and is dying of poverty, illness, consumed with a lack and consumed with ignorance about what to do to access what he sees. And this happens because there is gross miscommunication about what we already have designed to benefit our people. We have so many structures well planned, but how well communicated have these been done to local communities through their leadership? Because communities have respect for their leaders, the opinion holders of the community, the champions. Some of these champions and community leaders don't even know that what interventions that are put in place are actually meant to benefit their own people. And then when this opportunity comes to the community, they are bottlenecked. The services that come, the benefits that accompany with them are strangulated. Maybe the leadership in the community takes them all, drive their own people in there and get the benefit. But the poor woman in the hut, in the community, does not know that she has opportunity to partake of this. So we need to remove bottlenecks at the community level.
Because that could also be a problem on its own.
It is a problem on its own.
Sometimes personal or selfish interest.
And that is the bedrock of Nigeria's issue. We have so many selfish leaders who will not allow information to trickle down to the ordinary persons who may not even be their own relations. But remember, we are all Nigerians. We are our brother's keepers. Whatever touches you touches me. And if we don't have that mentality, we will make things work for the benefit of the poor. Remember, we're talking about the very poor.
Indeed.
The very poor sometimes are people who are even afraid to ask you, what do you have for me? They can't even challenge government anyway. Because when they open their mouth, they are shut down instantly. And these are the challenges that we are having in getting right information to our community people. So there is a need to create a larger platform, open new doors, avenues to communicate lavishly and largely with community members and their leadership, and those that they trust will transmit right information to them for their full benefit.
Okay, just before we go to the next question, I've been waiting for this, but you will see now sometimes the NGOs want to engage with communities. You see the leadership of the community say, don't worry, it's our people hunger first. It's somebody who has eaten, who's had something to eat, that can make a choice. A beggar doesn't have a choice. Just bring rice first. Bring noodles. Bring gari. Bring bread. Meanwhile, this person is sick in the body. So what comes first? The issue of actually engaging and understanding the core needs of the people. I think this is part of the problem. And so sometimes we cannot necessarily blame completely the NGOs or the intervention, the service providers. Because how do you go to a community and say, okay, we want to cite a project here? And the owners of the community say, no, don't worry, it's our people. Just bring small money here and there, we'll take care of them. And then somebody goes somewhere and just sits down in the office and writes a report because it is a foreign organization that is funding. They are not on ground. They just take pictures, write reports. So I'm mixing this into the next question. Can we also blame the international funders who just, look at reports on paper, look at pictures, and then send you money, send you more money, send you more money, without really connecting with the community to verify this project, what is the impact beyond what is on paper? So can we also blame the funders to say, look, you also have a blame to take here? Are they focusing more on reports and what is on paper over long-term impact within the communities?
Unfortunately, yes. When funders bring in projects, and to a large extent, there are no participation of local communities in the design and transmitting of the program's intervention visibly so that they can see. And then they have targets to meet, numbers of people to be reached, and the number of years for their program to be completed. And yes, don't wait for you. It becomes a challenge of whether what they are doing have actually benefited communities. But then the intermediaries, the NGOs, the INGOs, the CBOs of this world, who can write good reports, may not even have reached to the community, but because their times are due and they must write report, they write such report. And I call this leadership somersault, unfortunately, because it involves the funders themselves, the NGOs themselves, the community champions and leadership in the community themselves, who take largesse and forget that the people they are leading are supposed to partake of the health services that we are bringing to them.
Let me ask you this question. Is it possible for an international funder to come to Nigeria, right?
Yes.
Cite a project working with a local NGO or CBO,
Yeah.
without the government, through the Ministry of Health or the relevant ministry or agency of government, playing a supervisory role to ensure that corruption does not rear its ugly head in this process?
You see, you jolted my system when you spoke about corruption and creating a gateway for intervention to reach community and to be sure that there are no bottlenecks in the process. The person that is supposed to be the chief whip is the most corrupt of it all. When you bring funds, say how much of it is our own.
Are you talking from experience?
I'm talking from experience. And so the opportunity to benefit, to bring services to the beneficiaries becomes even smaller and smaller. The cost, the logistics cost to bring services to community is so huge. People to be serviced along the way, unfortunately, through what they say, oh, if you don't give this to us, then you won't get there. Are many. But then there is what we call participatory approach. The funders have the leeway, because it's their money, to go to the community and ask questions. How do you think we should provide the service to you? Without government entities necessarily stopping them. They don't have to stop them, because if you say you want to provide the services and use your money, and you are coming, if there are government agencies that are saying don't go there, say, okay, if you don't let me go, then I'll go back with my money. And it becomes a case of who needs the service and who is providing the opportunity. But then the issue of taking the numbers has been a challenge over time in many funded projects in Nigeria. I remember several years ago when I was deputy chief of party on a USAID funded project, the Federal Ministry of Health developed a proposal to apply for training on our interventions. Now, they sent the same proposal to CDC. The same proposal. Accidentally, when they wrote their reports, the two reports came to my table.
Interesting.
The one for the USAID and the one for the CDC.
So are you saying that the project was funded from two sources?
They got money from two sources. For the same 30,
For the same
people
project.
that they're supposed to train. Then my finance manager, a Canadian, he said, Josh, I have something for you. He brought the reports.
And they were the same
Word
reports
to word.
from the same organizations.
Name from the Federal Ministry of Health. Unfortunately, but I say this with a lot of caution and with pains in my heart, that directors at that level could do such things. And if I wasn't diligent sufficient, and incidentally, they brought the two reports 1 week after the other. But fortunately for me, I won't say unfortunately now, the first report that came, I didn't read it until the second one came. And it was not it's not laziness, it wasn't laziness on my part. So I moved it to my finance manager. I say, hey, look at this.
Take a look at this.
He said, come on, look at this. I have something for you. Names of participants, the same.
The same.
And we're talking about as far back as 1994, 3 million naira from two funding pipelines. And I asked myself, did the training even take place eventually after all?
Exactly. This is what we're talking about.
Because if they have the guts to do that, then in my mind, and then I was very young, about 36 years old, ambitious to bring opportunity to my country. And in my office, I was sitting. Why would our leadership do this to us?
Very interesting. The issue of corruption we cannot overemphasize.
Yeah.
Because I think beyond the development sector, this is one of the major issues slowing down development in Nigeria. The issues of development, be it in security and telecommunications. You know what the telecom services are like now. So God help us, but we cannot continue to fold our hands.
Reach out
Do
with
the wrong
hope,
thing and
changing
expect
hearts with
different
every
outcomes.
show. From the
If you just
stories
joined us,
that
the
we
program is
tell
Health Connect.
to the hands we
We're
teach
looking
to
at
grow.
why
ROI stands
health
for
services
everyone, where knowledge
in some cases,
lights the
not
way.
all.
Reach out
In
with
some cases,
help.
do not get
Let's
it.
make tomorrow safe.
Now, how damaging or inaccurate is data when planning health interventions in Nigeria? If you go abroad, they can tell you, oh, this is the statistics for this sector, this program. There is accurate data. The data is accessible. It is available. Do we have such data in Nigeria? Referencing the instance you just made now, where funds were released for supposedly two different projects, but it was one project executed.
And even if it was
So,
executed after
can
all,
you trust the data that such programs will generate?
that's the fear, unfortunately. And if we don't have the right data, we have misleading judgments. In the design of our intervention, in the packaging of the opportunities that we want to let go to the people that should benefit. Because the data are not correct. You got 3 million naira to do a training. Now you got 6 million naira and you train 35 people. And then you send 2 reports. That is already misleading information.
Misleading information.
Misleading information.
So let me come in there. If we have data that is not credible,
We can't trust.
how can you plan with that same data?
That's why I say it's dangerous.
It means you are simply, as a friend of mine would say, you are writing history to accommodate tragedy.
Exactly.
It means that everything else in that process will be faulty because the data on which you are basing your research and your findings and your intervention is faulty.
You see, you can't build interventions on faulty mechanisms. It is frightening. It is frightening because then you won't get the right impact where you want the program to be implemented. I don't know if I said it the last time I was here. We had UNICEF design interventions for my village in Benue State, Otobo. The youths were not even consulted. They go 3 kilometers to fetch water from the village in the morning. But they're happy doing that because that is when they meet their girls along the way. UNICEF came and said, UNICEF wash program. So, you are going too far.
Bring the water closer.
Bring the water closer. Put them a pump. 4 days later, the youth pour sand into it. So who did this? He said, we did.
Who asked you to do that?
You didn't tell us what we need and what are the benefits for our going 3 kilometers to get water. Yeah, you see, when we are designing program on faulty information that is not coming from due consultation about people's felt need, then we create serious disaster. We create problems between the youth, the elderly, the community champions, and even the funders themselves. And so there is this participatory approach in involving grassroots entrance into designing program and capturing their opinion or what they say are their felt needs and ensuring that the information they are providing, the data we are gathering are genuine, they are accurate, and therefore we can build our interventions around them and get the right impact. If this is not done, when it comes to measuring impact, you see a big holo because the services have not reached. The report is saying they have reached. You go to the community, they say, but we didn't see them.
We didn't see anybody.
Sometimes
they come in 1 week, take photographs, make videos, and they are gone. Nobody comes to check. The people we did free eye test for, are they seeing well now? Have their sights improved? The people we built borehole for, has it made their lives better? The people we built houses for, has erosion pushed the house down?
That's the challenge.
So, another critical question, but before I do that, please, if you're listening and you want to join the conversation, you can call the number 09. Okay, just a moment. I'll come back to that now. The place of poverty and corruption. Corruption is one thing. Poverty is another. Some people would say poverty fuels corruption. But let's look at it as a two-way train. It is either it is corruption or it is poverty. The person who has been given money to come and provide the service, who says, "Oh, this program was planned for 3 months, and let's just do 1 month and keep the what is left." The person you are going to provide the service for, he says, "No, just give." Somebody says somewhere, "Why are you going to do surgery? Leave to do the surgery. Buy small two mudu of rice and give to these people." It's intervention.
Yeah. I see poverty from two dimensions, and then corruption on its own. There is the poverty of the mind. Poverty of the mind leads to serious corruption. Because people who don't understand the implication of what they do, that are hurting humanity, are poor in their mind. They may be rich financially. And then there are people who are financially poor and vulnerable at the community level. And then those people who are poor in the minds are endemically corrupt, because they take what belongs to the community and to the generality of the population for their selfish end, milking the community. And that's where we have huge problems. I see many people who have managed projects, riding big cars, driving them to communities, and then the communities members are begging.
They're tracking.
They're tracking.
Some do not even have shoes.
Exactly. I remembered when I managed the HIV project in Benue, in Ogobia, the everybody teams will come with these their long vehicles with long antennas. Will come to a community like Ogobia, and the community people were expecting something to come, and nothing trickles down. So I told the manager, each of you is coming on this trip with 30,000 naira per day as per diem.
But yeah,
You spend 5 days here. 5 naira can make life improved for an orphan in this community. So if you are driving your cars and coming to create impression, please don't come to my community anymore. Because by the time you are gone, I carry the burden of answering the question, why did they come? What did they leave? What did they leave behind for us?
Interesting. Mr. Joshua, let's quickly give out the phone number again. You can join the conversation by calling 091 2259 6595. Because of time, let's begin to look at solutions.
Yeah.
How can we deal with the issues of corruption? What can communities do to help this process? What can governments do to ensure that when it is engaged to play a supervisory role or mediate in this process of intervention especially to some of these underserved communities, that even when you collect the money and don't do anything, nobody knows because nobody goes to check. They don't have access to the communication channels that we have in the urban areas. Solutions
are putting in place collective accountability measures at all levels that respect the opinion of each level. For example, if intervention has come to Obodo, I say for example, communities in Obodo should be collectively involved in asking accountability questions from the people who are implementing the program. When you brought this program, was it meant for us? How are we supposed to benefit from them? What are the anticipated benefit at the end of the day? Those are accountability questions. But if the communities are not empowered to ask accountability questions, then it leads to failure in program delivery. an impact measurement. The people who are implementing themselves, can they ask accountability questions from the donors? How much was brought to us anyway? And how much of it went to logistics to service you coming to give this money? And in terms of reality checks and the opportunities that we were supposed to get, how do we measure them? Are we true to ourselves that this program you have funded have justly delivered as intended
As
by the donor?
intended. Exactly.
And if that's not happening, it's become serious challenge.
Indeed.
So going forward, to eradicate corruption, and can you eradicate corruption in Nigeria? There is even corruption in the US. There's nowhere there is no corruption, but you can minimize. You can minimize. Get people to understand that whatever they do have accountability to humanity and to destiny and to God. If they have conscience. I guess that's what has kept me going in the journey of my life. Having worked in the development intervention for almost 30 years now, it's September this year, I'll be 70.
Congratulations.
Yes, so I have been part of, at the leadership level, development response. Each time I ask myself, I am a pipe that draws water from the tank for people to fetch. Pipe don't drink water. It allows water to flow. People who are managing projects must see themselves as conduit to provide service. If that sense and mentality is not there, then it becomes a challenge.
Yes.
So we need to create awareness. This position, this portfolio you are sitting on, do you know what you are supposed to discharge? And do you know whom you are accountable to at the end of the day? And is your conscience going to allow you to make it work or otherwise? So there are several ways to look at it. But me looking at it from how I have come this far,
Yes.
there is a need for people to let their conscience help them provide accountability judgment to improve intervention for the communities that are benefiting.
Well, Mr. Joshua, I wish we had all the time. But of course, Health Connect Forum is a continuous process. It's a platform. We'll be back here same time next Wednesday. But before you go, I want us to, if you will, close your eyes for a moment and imagine you had a magic wand that could fix one thing in all of the issues that we have discussed today. What would you fix and how would you fix it? In a few words.
I will fix our leadership somersault. Get the leadership to understand that leadership is a call of God. And if God has given you opportunity to lead, lead well. Lead to the betterment of the community you serve. Remember that there is a day of judgment, whether you're a Christian, a Muslim, or whoever you are. There is a day of accountability.